a plus. We haven't seen any snow here in the north. So I appreciate everybody coming out today. My name is Carrie Jafford. I'm the president of Unifor Local 229. And we really appreciate the folks that are here today to support us in our fight for minimum staffing and minimal levels of care in long-term care. So we have a couple of speakers planned. I'm going to turn it over to Phil Tupper, who's the Vice Chair of the Ontario Health and Federal Health Coalition. He's going to say a few words.
Thanks, Kerry. Well, good afternoon, ladies and gentlemen, brothers and sisters. It's amazing. I was going to say it's a pleasure to be here, but it's not a pleasure to be here. I've been doing this for since I retired in 2004, joining the Health Coalition, fighting to try and get improvements to long-term care, to home care, to hospitals. And it seems it never ends. We're standing here again today to talk about the abuses that are going on in this home and in all long-term care homes, not just in Thunder Bay, but across the province. It's unbelievable. The homes are telling us that they can't find staff. Well, I guess why? People aren't going to apply for a nursing job and you have to find a part-time job or 2 part-time jobs or 3 part-time jobs to make yourself to be able to live in this province. It's absolutely ridiculous. And here we are again talking about it. I want to thank everybody for coming out. I think it's an unbelievable fight that we have to continue to get this government to try and provide funding for full-time persons in these homes. It's just amazing that they don't seem to understand. The scenario has changed over the last X number of years. When people, back 20 years ago, when people go into these long-term care homes, sometimes they go in there with a couple to go in, and it was almost retirement living. Now the people that are in these homes are older. They take a lot more care, and the government doesn't seem to understand that. You have to work an awful lot harder to look after the residents in these homes. And we're here today because of that situation. And it's the residents and their families that are suffering. I'm the chair of the Family Council at Pinewood Court, and I hear stories from families there about the residents that are living there and the struggles that they're having. It's just unbelievable that the staff don't have the time. They used to have time to go and talk to the family member or the resident and see how they were doing and see how their family was. Now they don't have time. The workers are just so strapped and so busy that it's just unbelievable. And we've got to try and convince this government that what they're doing is incorrect, and they have to increase the funding for these homes so that we can get the proper amount of care that we want to give to our residents. So thank you very much for coming out. I'll pass it back to Carrie, and I think we have a couple of more speakers. So folks, carry on the fight, and we're going to win this if we keep on pushing. Thank you.
Thank you everybody for coming out today to show your support for this important issue. I want to recognize the other unions that are here participating today. ONA, PSAC, QP, and OPSI, thank you very much, because everybody's got to work together in order to be successful in the ongoing fight with respect to long-term care facilities. You know, what's happening in our long-term care facilities is nothing more than absolutely shameful. What's going on is that the funding is so bad, the nurse staffing levels are so bad that our members of other unions, workers in long-term care, leave going home at the end of the shift after working through their breaks, after working through to the end of the day, staying extra sometimes to provide the care that they can, but they don't have the resources. There's not enough of them that they can provide appropriate care for the seniors that live in our province's long-term care facilities. And they go home feeling guilty, and they go home feeling down, and they go home really not wanting to come back the next day because it's a shame what's going on in there. It's shameful that these seniors who built our communities, this is the best that we can do for them. If you do not have the capacity, if you're a senior in a long-term care facility in this province, and you don't have the capacity to advocate for yourself, to direct your care, to perform your own care, or you don't have a family member that'll come in every day and do that for you, then you suffer. That's what this issue, this campaign is about. It's about our seniors in the province of Ontario suffering. And it's time that the province stop when they hear about issues in long-term care facilities going in and talking about enforcement. They've got standards around food, they've got standards around everything in long-term care facilities, and that's all they focus on. But there's no standard that a long-term care operator has to meet with respect to the amount of care that they provide a resident. And so people fall through the cracks, and again, they suffer. We need a measurable standard of care in long-term care facilities across the province. This is an issue everywhere. Too many times we've been standing on the front of these types of facilities for too many years saying the same thing. So we want to work with the affiliates, our partners, the Health Coalition, from the province of Ontario and in our National Canadian Health Coalition to move our agenda forward in long-term care. This isn't an issue about compensation for workers. This is an issue about dignity and respect for the residents who live in these facilities and the people that work in them. And it's time that we did that. So with your help, brothers and sisters, we'll get it done. Thank you very much for your support.
Closely, very quickly about what it feels like to go home or come to work at the beginning of the day and then come home at the end. Leslie? It's all right. Leslie, all you have to do is maybe tell us what it's like to go to work. Maybe just to paint a picture of a 1 8-hour shift working as either an RPN or a PSW at work.
So, along with coworkers and people whom I have not met, I'm sure the outcome of our day and the start of the day is very similar. Our first concern is, are we going to be able to get our tasks done today? How many people will be there? And will we have the support that's needed to allow our residents to have the best possible day? Because at the end of the day, that's all any of us ever want, is for our residents to be taken care of. Many of us work shift work, leave family, miss things. This is what we've decided to do when we've gone into healthcare. But in doing that, we want to be able to feel that at the end of a day, we've made a difference in somebody else's life. And some days I worry that I haven't done that. And so when we leave our home to come to a home, our first and foremost is their safety, their dignity, their independence, their preference, their privacy, and their safety. And when we have such minimal funding from our government, it is very hard to ensure that on a daily basis. And that for me is why I got into nursing, is so that I know that I can make a difference in somebody else's life, no matter how small or how big in that day. Because for a lot of people, even saying good morning or having that little bit of person contact, the client-centered care that our government so preaches about at the staffing levels that we have, is very, very difficult. Even though as frontline workers, it is something that we strive for. It is something that we put ourselves forth in our occupation, for lack of a better word. And I'm saddened that after all the years, because I know from family who have been nurses and elder generations, that it hasn't changed for umpteenth generations, and yet it's my generation and nothing has improved. And that's sad for our government to say that there isn't a problem when there very much is.
Thank you. Thank you. Great job. Great job. So we just want to say thank you very much. Our key idea today is by gathering people and having this information rally to really highlight for the public, the general public, the people who aren't working in long-term care, or the people that don't care or have family working in long-term, what's really going on, what's really happening in the homes. And as you heard from Leslie, what we hear from the staff as union representatives and working with in the actual homes, doing investigations on allegations of abuse and allegations of neglect, and our members suffering physically, being physically assaulted, residents being physically assaulted daily. This isn't just once in a while like the government wants us to believe. This is happening absolutely daily. Our staff people are working, our members are burning out. This is a bigger issue than just one home. We have different levels of care based on the funding that people can afford or what home they actually end up on. Like Andy said earlier, there is no minimum staffing ratio or no minimum hours of care being provided, but they do tell our enforcement comes in and writes orders on the home for one of our members standing up to assist 4 people at a dining table when there's 100 people in the room that they have to help feed and there's only 3 staff members. the home will get cited for me feeding or assisting more than one person or two people at a time table. So I have to help you with your food or your lunch, and I help so-and-so with their lunch. If they see me helping a third person at that table, it's a written enforcement act against the home. Or the fact that the residents are eating their dessert before their supper. The home can be cited for that. But there is no backlash, or there is no citing or orders written for when we have one staff member to 28 residents to get up and get ready to get to the dining room in the morning. That's less than 6 minutes. 6 minutes of care provided. I don't know about you, but it takes me longer to 6 minutes in the morning to open my eyes and to be actually have to be dressed, toileted, ready, meds passed to be sitting at a dining table that I don't want to be at because I don't care to be out of bed. I wanted to sleep in this morning. It's shameful and it should be illegal. So we're really looking forward to all of your support in this ongoing campaign. We will be partnering, as Andy said, with our other affiliates, our OPSU sisters and brothers, CUPE, ONA, all of those folks, as well as our coalitions, our Ontario Health Under Bay Health Coalition and the Canadian Health Coalition. But we need to make this a key campaign issue in the upcoming provincial elections in June 2018. We just did some work politically and found out that healthcare is not even on the agenda or the minds of the people that are voting. Other ridiculous issues are, and so it's really up to us in this community, as workers, as residents, and as family members, to push the agenda for our seniors and the most vulnerable people in our society to have a minimum staffing ratio and minimum standard of care in long-term care. Are you with us? Very good. So thank you very much for coming out today. Grab a cup of coffee, and thank you for making this part of your day. Thank you.
I'm just going to make sure my level.
Trying to get out to people who don't work in long-term care homes.
So really today's rally was an opportunity to try and bring awareness to the public of what's really happening in long-term care, not just for our workers as a union, but also for our residents that are living in
Are happening.
So yeah, everybody wants to know the scary details without scaring the heck out of people, so they don't want to go into long-term care. What we find really alarming is resident-on-resident physical assaults, verbal abuse, resident on staff verbal abuse, physical assaults. We're talking spitting, kicking, punching, pulling hair, choking, pushing, all of those kind of things. And really those are results of improper staffing and funding ratios or staffing levels. When you're trying to get someone out of bed and dressed and toileted, and you need to do that in a very short period of time in order to meet the regulations to get them into a dining area or dining room, people aren't really going to be always happy to do that. And so that usually, kind of that's the way they start the day. I don't know, when I start my day and I'm, late behind or whatever, and I'm rushing, it doesn't make for a very good day for me. And so that's really one of the issues when you're looking at decreased staffing levels. One nursing person to 28 residents or 14 residents, it doesn't make for a good start for those residents. And those are just results of that. We've had people, gotten injured or had to leave work, and there have been whole areas that have not been seen. So we have a whole unit of people. Some stories I hear at some of my long-term care facilities that we represent, where a nurse didn't even know that they had to go to that for. And so those people had no vitals, no diabetic medications provided for hours on end, and so that's kind of the worst stories that we're hearing. The problem is that it's consistently happening daily throughout long-term care in Ontario, but even more alarmingly throughout Thunder Bay and the region.
So the current means aren't working for staff and residents alike.
Well, most importantly, they're not working for residents. Our staff are doing the very best they can, and you heard from some folks who don't always want or can't speak out publicly, that say, look, I do my very best. I come to work and I want to care for my patients in the way that they deserve and the dignity that they deserve, and then they don't have the time to get everything done in a day. The pressures are such that they're feeling that they're providing that kind of care. There's no regulation or minimum standard to say that as someone living in long-term care, you deserve at least 4 hours of care in a 24-hour period. We don't have a regulation on that, and that's criminal. We have a regulation on when you can eat your dessert. We have a regulation on how many people can sit at a table and how many workers can assist that person to eat. But we don't have a minimum staffing ratio to say if I operate a long-term care facility, got 121 beds, that I need X amount of staff to run that home safely and care for those residents with the due dignity and respect that they deserve. It's gone beyond not feeling good about it. It's unsafe, it's inappropriate, and it's I would say criminal.
Would you say it's the government and other agencies just not keeping up with the design?
Yeah, so the funding levels have been an issue for a long time, and a lot of the regulations were cut under a previous PC government under Mike Harris, which was like 15 years ago, warning that we have an aging population. So not only are our funding levels either stagnant or not enough, we are growing. We have more than 800 people waiting for long-term care in the city, and we have a brand new facility that has a new unit, 64-bed unit that can't be opened, which is causing a backlog at St. Joe's Hospital, a backlog at Thunder Bay Regional Hospital, and it's leaving people at home being provided an hour here, an hour there of home care. That's leaving them at risk as well. And so we need to look at the whole picture. And one of the biggest pieces of that picture is actually having people that live or care or have family members or people that work in long-term care at the table to make those suggestions and decisions, instead of a bureaucrat, in Toronto that thinks it's a really good idea that we provide $156 a day to someone on long-term care, because that sounds like it should be enough. I don't know what it costs you to eat a day, but it costs me more than $8.33, I'll tell you that, in Northern Ontario, unless I want to eat craft dinner and pop. So it's a very large, intricate level issue. We need to make this a campaign issue in the coming provincial election. I know people are aggravated and upset with all sorts of things, but this long-term care fight has been 10, 12 years we've been lobbying, and we're not getting anywhere. And so I would invite the Premier and any MPP that's running for office to come and spend a day side by side with any worker, whether you're from environmental services or a frontline nursing person, to spend a day with our workers in any one of our facilities, and then we'll see what kind of change can happen legislatively.
Where you see this going forward after this rally?
So the purpose of today's rally is to start to publicly engage the community, get the community engaged. I've been approached by 3 people already today that said thank you very much. I didn't know that you as a union take on these roles, and I have 15,000 friends on Facebook. Like some other gentleman said, I just lost my stepfather 3 months ago in long-term care, and I have a loved one here in long-term care, and I want to get this message out as well. And so building those coalitions amongst community members to have more and more of those discussions. We'll probably be holding some long-term care, some town halls, and really adding the pressure to not just our MPPs locally, who normally are very good to bring our voice to down south for us, but we have to get the conversation going right across Ontario.
Would you be able to just a quick rundown of some of the other supporting unions that are here today?